looking at us, Domes? Of the 56 million who die each year, around 30% of them do so because of cardiovascular diseases, making them by far the biggest killer globally. The only part of the world where they aren't the leading cause of death is Africa. You can probably figure out why. You can probably also work out where in the world they claim the most lives, given that they're strongly linked to lifestyle and getting old. All of this makes them a natural target for stupid and the people who peddle it. Just like with cancers, quacks are making a lot of money on scamming people into buying needlessly complicated diet plans and expensive nonsensical non-cures. So, let's meet one of them and tell him how we really feel.
I want to know if you or anyone you may know has any type of heart and artery disease.
Getting right to the personal questions, I see. Fair enough. No, I don't have either of those conditions, for the simple reason that I don't have a heart or arteries. But yes, I do know people who suffer from them. The man who is just on your screen is Dr. William E. Richardson. Yes, doctor. Because unlike all of the other doctors we've had the displeasure of meeting on this channel, Dr. Richardson is an actual MD. Unfortunately, he's the kind of MD who has abandoned the scientific foundation of his profession and joined the dark side. Willie is the founder and medical director of the badly named American Clinics for Preventative Medicine. Badly named because despite the S on the end of clinics, it's actually only a single location in Atlanta, Georgia, offering full-on woo like Reiki, ideology, and vitamin C against cancer. Neither of which are preventative nor medicine. You may want to consider a name change. Personally, I suggest the Atlanta Circle Jerk for Pretend Medicine. That way you get to keep your domain name.
And we're talking about coronary artery disease, which is clogged arteries in the heart.
No, that's what it's caused by. Clogged arteries, at least the kind we'll be talking about, is called atherosclerosis. And a coronary artery is the blood vessel which feeds the heart. Coronary artery disease, then, is a broad term for the conditions, like chest pain and heart attacks, you get when atherosclerosis in the coronary artery starts to seriously affect the flow of blood to the heart.
Cerebrovascular disease, clogged arteries in the brain.
No, it isn't. Cerebrovascular diseases are conditions affecting the brain's blood supply. It's a collective name for such lovely things as strokes and brain hemorrhages. Atherosclerosis can be a direct or attributing cause of these, but it's by no means the only one, and that doesn't make them interchangeable terms. One is a risk factor of the other. You might as well have said that hip fractures are osteoporosis, or that lung cancer is smoking. Seriously, that's how nonsensical your stupid is.
Or peripheral vascular disease, clogged arteries in the legs.
Okay, now you're just doing it on purpose. Peripheral vascular disease is a general term for decreased blood flow in blood vessels other than those in the heart and brain. Clogged arteries is still called atherosclerosis. The type of peripheral vascular disease caused by it is called peripheral artery disease, and in case it's unclear, no, none of those terms refer specifically to the legs. That's just the first place most people start getting symptoms in the form of pain and cramping, especially during exercise.
We're talking about erectile dysfunction, clogged arteries going to the genitalia.
No, erectile dysfunction is having difficulty getting and sustaining what the kids nowadays call a boner. It can have a number of causes, both psychological and physiological. Yes, that includes atherosclerosis, and yes, that is one of the more common causes. But once again, that doesn't make the two synonymous. In fact, ED due to atherosclerosis would technically fall under peripheral artery disease.
In men.
Really? You don't say?
So these diseases, as well as diabetes and negative effects of diabetes, are remedied greatly by IV EDTA chelation therapy.
They actually aren't, but we'll get to that. Because to understand why they aren't, we first need to know what atherosclerosis is. And since you're not gonna explain that, for wallet-related reasons, I'm gonna have to do it myself. Which is probably for the better, since you would most likely fuck it up. Plus, it makes me look smart. Atherosclerosis is what people talk about when they tell you that all that fatty food is gonna clog up your arteries. I don't think I need to tell you, dear viewer, that that's an oversimplification, and that the condition is a little more complicated than that. Arteries have three main parts to them, all with fancy Latin names. An outermost layer of connective tissue, called the tunica externa, the tunica media, which contains smooth muscles and more connective tissue, and the tunica intima, which mostly consists of a single layer of cells lining the inside of blood vessels, called the endothelium. Now, atherosclerosis doesn't actually clog up your arteries with fat like it's a kitchen sink. Instead, what happens is that damage to the endothelium allows the fat transporting protein LDL, aka bad cholesterol, to cross the tunica intima. This grabs the attention of a type of immune cell called monocytes, which start gobbling up the LDL to get rid of it. Normally this works, but if there's too much LDL, the monocytes basically end up eating themselves to death. As this layer of morbidly obese cells grows, it eventually ruptures the endothelium, and as part of healing this injury, the platelets from the blood that initially patched up the hole release a growth factor. The smooth muscle cells in the tunica media respond to this growth factor by multiplying and releasing collagen. The end result of all of this is an atheromatous plaque, a lump of fat, cholesterol and dead cells with a collagen-rich cap. As this process repeats, the artery slowly, over the course of decades, becomes narrower and less flexible, which, yeah, is as bad for you as it sounds. One final thing before we go back over to Dr. Bill to hear how he thinks we can fix this, and this will become important later. In the later stages of the condition, it's not uncommon for small calcium deposits to start forming inside some of the oldest plaques,
which we've been using for over 20-25 years to treat all of those problems.
And bloodletting and exorcisms have both been used for way longer than that. That doesn't mean shit. Wait, did you say 20-25 years? Because that's how old I am. Does that mean I'm the cure for heart disease? Holy shit, I'm the cure for heart disease. I gotta tell someone.
Recent studies have shown the validity of this remedy in treating cardiovascular disease.
No, they fucking haven't. There's been plenty of crap studies that people like yourself claim validates they're stupid, but none of the properly done studies published over the last 50 years has found any evidence to support you. Not that that has stopped quacks from claiming they do, of course. Even the $30 million trial to assess chelation therapy, or TACT for short, failed to find any meaningful benefits. And that was a flawed, politically motivated study, which was biased from the onset and performed mostly at alt-med centers by people promoting even dumber stupid. If you can't make that give you the results you want, only lying will. Which is of course exactly what all the alternative medicine blogs and sites did. On an unrelated note, am I the only one who finds it odd and a little concerning that you basically just admitted to having used a treatment that was only recently validated for 25 years? Or does a third of the average human lifespan ago count as recently for you?
We're talking about IV EDTA chelation therapy.
Yes, I think we got that when you said it like 20 seconds ago.
The main ingredients is the EDTA, which stands for ethylene diamine tetraacetic acid.
That is indeed what it stands for. EDTA is an organic compound with a molecular structure that looks like this. It's a chelating agent, meaning it can do a neat chemical trick, called chelation, hence the name chelation therapy. Chelation is a specific type of bonding between a compound, the chelating agent, and a metal ion. The trick is that the chelating agent forms multiple independent bonds to the same metal ion, so you end up with something that looks like this. The effects of the bonds essentially add up to one very strong bond, locking the metal ion in place and making it harder for it to react with other compounds. EDTA was one of the first chelating agents to be synthesized and has found a number of uses over the years, including as a drug. Yes, just like how Dr. W.E. Dixon is an actual MD, EDTA is an actual drug used to treat lead poisoning. Or rather, some types of EDTA are. You see, EDTA has several different salts, with different effects and levels of safety. In other words, it's not irrelevant which one you use. In light of this, you would think you would inform potential patients which one or ones you're giving them. But you don't. Trust me, I checked. You do, however, mention being certified by the American Board of Chelation Therapy, which by the way has changed its name to the American Board of Clinical Metal Toxicology, so you may want to update your site. And that you're using the American College of Advancements in Medicine's treatment protocol. Both of these turn out to be organizations trying to legitimize old med in general and chelation therapy in particular, through a combination of having fancy sounding names and offering certification in stupid. Based on the information on their sites and having read up on the topic before writing the script, you're most likely either using disodium EDTA or a mix of disodium and magnesium EDTA.
We're talking about a remedy that is given IV, so it goes throughout the whole body.
No, IV means it's injected into the bloodstream via a vein. It stands for intravenous. I thought they taught that in medical school. Anyways, EDTA is a decently sized water-soluble molecule, and so doesn't mix well with fats. Fats, such as the lipid bilayer that makes up a cell membrane. Because of this, it's not only not able to get inside cells, it also has a hard time crossing the blood-brain barrier. In other words, no, it's not gonna go throughout the whole body. You know where it's also not gonna go? Inside the atheromatous plaques, because to do so requires crossing the endothelial cells of the arteries. It also doesn't help that the plaques are made up primarily of lipids. You would think that that would be a hint that EDTA might not work terribly well as a treatment against them, but as we shall see, the Quacks have solved that problem by creatively making up new and exciting ways in which the body doesn't work.
And pulls heavy metals out, such as lead, cadmium, arsenic.
Yes, it does do that, which is why it's used to treat heavy metal poisoning, especially lead poisoning. Or more precisely, that's what calcium disodium EDTA is used for. Disodium EDTA isn't. It used to be, but has been phased out in favor of its calcium-containing sister, because said sister has a better safety profile. Not that it's harmless, no drug is. In fact, both of them have some pretty nasty potential side effects, which makes you giving the least safe of them to people for no good reason just that little bit worse. EDTA, in either form, doesn't just bind to and strip out lead and cadmium, but also important dietary elements that your body needs, like zinc. The difference is that disodium EDTA also binds calcium ions, which are pretty much involved in anything your body ever does. As in pick any process and it probably needs calcium to work involved in everything. Calcium disodium EDTA comes pre-packaged with its own calcium and so doesn't have that problem. Also, I would like to point out that your treatment protocol isn't the same as the one recommended for heavy metal poisoning.
Lead and cadmium have been associated with tumor growth, so this is even good for reversing or preventing cancer.
You just couldn't help yourself, huh? You just had to get the C word in there. Lead has been associated with certain types of cancer and is classified as a possible human carcinogen, while cadmium is a known carcinogen linked to lung cancer and associated with other types. So yes, removing them might lower someone's risk of cancer. Fair enough. That doesn't mean chelation therapy for everyone is a practical, effective, or even remotely good idea. Also, how exactly does removing lead and cadmium treat cancer? The tumor is already there. Are you suggesting that cancer cells need cadmium to stay alive or something? Never mind that all of this is completely irrelevant, because, and this really should go without saying, if someone has or suspects having either cancer or heavy metal poisoning, they should be seeing an actual medical professional, not an MD practicing pseudo-medicine at a glorified health spa.
And certainly cardiovascular disease.
Hold on, that doesn't sound right. Let's take a look here, shall we? Certainly, adverb, used to emphasize the speaker's belief that what is said is true. Okay, I see what went wrong here. Let's try again.
And certainly
not
cardiovascular disease.
There you go. Now your statement is in line with the scientific consensus. You're welcome.
So, it pulls these metals out through the urine.
Yes, 95% of EDTA is excreted in urine. The remaining 5 are eliminated by the liver in bile. In either case, the EDTA and anything bound to it ultimately ends up in the toilet bowl.
It pulls calcium out of heart and arteries and puts magnesium back in.
And at last, we get to the high cholesterol meat of all of this. Exactly how EDTA is supposed to cure atherosclerosis. which you decided to explain as vaguely as possible. So let's fill in some of the blanks. In a nutshell, the idea behind chelation therapy is that the EDTA will remove the calcium deposits. That's what he means by pulling calcium out of arteries. I'm not really sure what he means by pulling it out of the heart, since that's not where the plaques are, and it wouldn't exactly be healthy, since just like any other muscle, the heart needs calcium to function. Maybe he means the arteries in the heart. As for the replace it with magnesium thing, I would really like him to explain how that's supposed to help. Because I have no fucking idea. In any case, none of this happens, because as I mentioned earlier, EDTA can't cross the endothelium. But remember how I said the Quack solved the problem of people debunking their made up mechanism of action by just making up new ones? Yeah, they came up with a new one. In the new and barely improved version 2.0, instead of the EDTA removing the calcium directly by chelating it, it does it indirectly by chelating the calcium in the blood. Low levels of calcium in the blood increases the release of calcium from the bones. The idea then is that when the bones are rebuilt, the calcium used to do that will be drawn from the plaques. In reality, that doesn't happen. Because it plays a role in practically everything the body does, calcium is very tightly regulated. For the deposits in the plaques to supply the calcium for the remineralization of bones, there would have to be a mechanism responsible for it. As of uploading this, no such mechanism has been found. What has been found is that the calcium for the rebuilding comes from the blood. The same hormone that causes the release of calcium from bones, called PTH, also causes an increase in the absorption and reabsorption of calcium in the intestines and kidneys respectively, keeping its level relatively stable. But you know what, I'll play along and pretend that chelation therapy does exactly what it says in the tin. Just how much calcium does your treatment actually remove, and is it enough to make a difference? Well, we can find out using good old basic chemistry. According to your website, a single treatment typically contains 3 grams of EDTA, presumably disodium EDTA, so we'll go with that. Disodium EDTA has a molar mass of 336.2 grams per mole, a mole being the name of a specific amount. The same way a dozen is 12, 1 mole is this monster of a number. If we divide the mass of the disodium EDTA with its molar mass, we get the amount of molecules measured in moles, which turns out to be 0.0089. 1 molecule of EDTA can bind 1 calcium ion. So assuming that all of the EDTA does that, something which doesn't actually happen in real life, one treatment would remove 0.0089 moles of calcium. Calcium has a molar mass of 40.1 grams per mole. So 3 grams of disodium EDTA can at best chelate 0.36 grams of calcium. That's not a lot, considering that most of you opaque meat people have somewhere between 1 and 2 kilograms of calcium in your body. Add to that you already get around 1 to 1.5 grams of calcium a day from your diet, and that number and the reabsorption in the kidneys increase in response to lower blood calcium, and it's looking pretty unlikely that anything is actually getting decalcified. Even following the protocol, which calls for at least 20 treatments with up to 3 treatments per week, won't make a difference, because by the time a treatment is given, the effects of previous ones will already have been corrected for. Of course, all of this relies on the idea that removing the calcium would actually do anything other than jack shit and fuck all. Which is all it would do, because the calcium deposits just aren't that important. If they mattered for the formation, structure or size of the plaques, they would be present from the beginning in all of them and take up more than a tiny fraction of their volumes. In reality, they're a tiny late-stage feature that forms in some plaques. In other words, you are proposing a useless solution to a made-up cause of a real problem. It's like trying to fight climate change by using a vacuum cleaner to lower the atmosphere's helium content.
It has 8 other type mechanisms that help make this remedy fantastic.
So one thing I didn't mention is that when quacks make up new ways for chelation therapy to work, they don't abandon the old ones. Nope, they keep them around for later use and will switch between them as they see fit. Or in situations such as when you, wanna make chelation therapy sound really impressive, bring up all of them at once. An excellent example of the former is that the mechanism Willie talked about in detail is in fact the original one, from the 1960s. That's right, he's basing his treatment on a medical understanding that was already outdated when he started using said treatment 25 fucking years ago. And since then, there's been 8 new mechanisms that he's taken to heart. Actually, let's go back to that list of mechanisms. Since we weren't told what you think is on it, I can't really comment on them. But 2 of my personal highlights from lists from other sites are the indirect decalcification that I already dealt with, and the rather strange idea that arterial plaques are actually benign tumors and that EDTA prevents arterial cells from mutating.
So, if you have or know anyone who has these problems, heart disease, erectile dysfunction, peripheral vascular disease, diabetes,
otherwise known as nearly everyone, most people, and the majority of the human species,
and you just want to look younger because it has an anti-aging component as well.
Holy pseudoscience, Dr. Batman! Is there anything this wonder drug can't do? You know, besides most of the things you've mentioned.
And it increases energy as well when you get rid of those heavy metals.
Yes, tiredness and fatigue are symptoms of heavy metal poisoning. Congrats on getting something right for a change. But you know what they're also the symptoms of? A very, very long list of other diseases, a lot of which goes away on their own. But of course, now that you have planted the idea of heavy metal poisoning in the minds of gullible people, they will ignore those, and you get to take the credit when they stop feeling tired.
You know anyone like that?
Anyone like what? You kinda distracted yourself with your own stupid in the middle of that sentence.
Let them know about EDTA, chelation therapy.
Yes, please do. You can tell them not to waste their time and money on it. We're talking about a treatment that is based on outdated ideas, can't work in any of the ways proposed, has been shown to not work at all, and has the potential to cause serious side effects. It's not just stupid, it's dangerous stupid. And you really should know better. You are an insult to the title of medical doctor, and I have absolutely no problem calling you that.